Glad to see you here this morning. Very important time for us in the life of Fairhaven, in the life of our community, in the life of our nation. We'll take some time today to talk about the current status of coronavirus in Whitewater, and we have the honor of having Dr. Wedl here this morning. As you know, there's a lot of conversation that's going on around the vaccine and what it's doing and what the importance of it is. And personally, what I would say in our environment, whatever your beliefs are, one of the things we want to do is be very sensitive. As far as the board is concerned, we are watching and waiting to see what the CDC and CMS come out as far as guidelines. And we will be following, we have no option but following those guidelines. We know it will be mandated. And in that process, it is something we have to look at and do. Part of it is our funding. Over 90% of our funding comes from the Medicaid and Medicare processes, so we have not an option there on the funding side of it. On the other side of it, we care for the most vulnerable. One of the things I was recently listening to is a person of advanced age and the compromised setting that we work in, especially second floor, and many of our apartment residents are vulnerable in the state they are. Even with the vaccine, they are more vulnerable, even as we're starting to see some things getting underneath it. But the more protections we can put in place and try to prevent it from entering into the community again. We saw the devastating impact of Corona last year, where over 40 of our residents passed away in a very, very short period of time. Many of them were older, advanced, compromised medical conditions. We don't want that to happen again. And so today, we want to talk about the vaccine, what it means, what the implications are, and nobody else better to do it than Dr. Wedl. So would you like to start us this morning? Sorry. Very good. Say that again.
Oh,
Can you turn the light on?
I think I'm okay.
Well, for seeing you.
Oh, okay. I don't need to see me. So I just want to make sure that everybody has an opportunity to ask questions about the vaccine, particular things. Karen did submit some to me that some of you had given her, so I will try to address those. But if anybody else has any questions, just please shout them out. As far as the vaccine, I'll just dig into that. I mean, I think all of us know enough about the COVID illness and what it can do and what it has done, particularly here, to understand that. But the vaccines, just in general, there is absolutely no doubt that they're extremely effective. So I hope everybody understands that and believes the data that we have. You could see, think about last November, if any of you study or look at least the CDC website or the Wisconsin DHS website has really, I don't want to say wonderful graphs, but graphs that really demonstrate very well the burden of disease. And November was just this huge spike. And then once we started seeing the vaccine coming into play in the first of the year, in the spring, our rates just really went down. So if you haven't scrolled through the CDC website or DHS website or World Health Organization websites for information on coronavirus and the vaccine, they're very helpful, accurate information, and I think very understandable too. So it's not incredibly technical that it's hard to understand. So vaccines, very, very effective. Unfortunately, so we went through this kind of nice quiet period where things were looking better over the summer. Unfortunately, with the new Delta variant, the Delta variant, the biggest difference with the Delta variant is it's much more transmissible than the previous types of the COVID viruses that were out there. So it's much easier to pass from person to person. And we're seeing, as you've probably heard in the news, many more children being infected. The virus doesn't seem to be necessarily more dangerous for children or necessarily targeting children, but just because it is so much more transmissible. And we have this huge population of unvaccinated persons, children. That's why we're seeing so many more children. But of course, there are, what's called breakthrough cases in persons who have been vaccinated, and then of course many cases in adults who could have been vaccinated but were not vaccinated. As of last week, and I'm sorry I can't cite a source for this, but we've all heard this, something like 99% of the hospitalizations in adults right now for COVID disease are unvaccinated people. So even if there are breakthrough cases in vaccinated persons from the Delta variant, those people are not getting as sick, they're not getting in the hospital, they're not dying. So even if there is a breakthrough case when you've been vaccinated, the disease seems to be so much less. And that's similar to, maybe some of you know that about the influenza vaccine. The influenza vaccine, it's amazing. The COVID vaccines have been about 90% effective, 93, 95, depending upon which study you look at. Annual flu shots every year are in the order of 60 to 70% effective. So it's not a minor miracle that these vaccines came out and were so darn effective. We should feel very, very lucky that they've been as effective as they had, and take advantage of that. So anyway, vaccines are effective. Safety, I think that is concern of some people, the safety of the vaccines. Of course, when they first came out, there were reports of, anaphylaxis and severe allergic reaction. Those reactions seemed to be limited to people who'd had history of anaphylaxis before to something else. And the rate of that right now is about 3 to 5 people out of every 1 million people who get the vaccine have an anaphylactic reaction. So that is pretty darn low, when you look at the big picture. So probably, I guess, again, I can't quote you exactly, but think about a medication or some other treatment. Think about how often you might see a severe allergic reaction to a medication. Rates of severe anaphylaxis to COVID vaccines are probably less than, if we looked at an antibiotic or something like that. So extremely low. The rates of other serious side effects also extremely low. There was the association of blood clots with the Johnson & Johnson vaccine. That was also extremely low, and probably not even higher than the rate of that type of blood clot in a general population. So it's questionable whether that was truly from the vaccine or not. So the vaccines are very, very safe, very effective. Then I think what I'll do, does anybody have questions right now? No. Okay, then do people have questions or want further understanding about how they work, how the vaccines work? Yes, no? I'll address that a little bit. So they're an mRNA vaccine. So what the heck does that mean? I'm sure all of you have heard of DNA and RNA, studied that in school. But mRNA is kind of like a pattern. If you think you're sewing a dress or something like that, you get your pattern, and the pattern tells you, what to make out of the fabric. So mRNA enters the cell, and it essentially instructs our cell on how to produce proteins. Any mRNA does that. That's its job. It produces a protein for what's called the spike protein. So the COVID virus has a little protein on the outside of it called the spike protein, and that's how that's one of the mechanisms by which the virus enters our cells. So the mRNA instructs our own cells how to produce this spike protein. The spike protein is then demonstrated on the outside of our cells our body recognizes that as foreign. Just like if you had a virus inside you, a bacteria inside you, something that's foreign in our body, our immune system recognizes as so and then produces antibodies against it and will help destroy that foreign invader. So one of the things that I've heard, people say about the vaccine is it affects our DNA or it changes our DNA. It really has nothing to do with our DNA. Our DNA, our own individual DNA, is inside the nucleus of the cell, going back to high school biology or college biology for all of you. The nucleus of the cell is kind of what people call the brain of the cell. That's an internal organelle inside our cell. That's where our DNA is. It's protected in there. The mRNA never enters the nucleus of the cell. Our DNA never comes outside of the nucleus of our cells. So these vaccines are not genetic modification. They don't change our genes. As soon as the protein is produced, the spike protein is produced, the mRNA is broken down and discarded. It's not needed anymore. So I know that's one thing that people are concerned about, that this will change my genetics or change me in some way. It doesn't do that, and it's temporary. It's not permanent inside of our cells. So another question that Karen submitted for me, which is a great question, and I wish there were more solid answers, but how long will immunity from the COVID-19 vaccines last, and how long will immunity from COVID-19 infection last? And bottom line is, we're not sure, we don't know. More studies need to be done. But what we can say is, when vaccines are developed, they study, tens of thousands, hundreds of thousands of people. They study different makeups of the vaccine. They study different doses of the vaccine. So by the time they get to a finished product, they have tested this vaccine on tens, if not hundreds of thousands of people, and can see a very consistent, predictable immune response from the vaccine. So it's very measured. So what we know about immunity from vaccine, it's, again, very predictable and to a certain level. And of course, because it's a new vaccine and this is a new disease, we don't have significant longevity studies to tell us how long the immunity lasts. Immunity from disease is very different. Some people may have a very mild infection with COVID-19. Some people may have a very severe infection. Everybody has different characteristics about, their own health and their own body systems. So what you see with immunity from disease itself is much more variability in the immune response. Some people have a great immune response that lasts a very long time. Some people have a very little immune response from disease. So even though we can't say exactly how long immunity lasts from disease versus a vaccine, what we can confidently say is that, immunity from vaccine is very predictable, very studied. We know it happens. We know it happens to a certain level, while immunity from disease it's there, but it's just less certain and it's more variable from person to person. I came across a very interesting study last week out of, it was in Kentucky, and they took I think it was about 500 people who had COVID disease, who had documented, tested COVID disease sometime in the year 2020. And some of those people who had previously had disease had the vaccine, and some had not had the vaccine as well. So people who've had the disease, they had presumably some degree of natural immunity from the disease, as well as on top of that had vaccine immunity. And then you had other folks who had just had the disease and had chosen not to get the vaccine. We're seeing reinfection with COVID at this time because of the Delta variant. And the rates of reinfection between those two groups was very, very different. Those who had had the disease and vaccine had very low rates of reinfection with the new Delta variant, while those who had had just immunity or whatever immunity they had from just the disease and not had the vaccine had much higher rates of reinfection with the Delta variant. So that was a really interesting and great study that demonstrates that, disease plus vaccine gives you better immunity than just disease alone. Other questions that I received or that I hear a lot, use during pregnancy. So just recently, the CDC has come out and, unequivocally stated that they recommend COVID vaccine for all pregnant women. Pregnant women are at much higher risk of much more severe disease from COVID illness than non-pregnant women. Much higher rates of ICU admission, hospitalization in general. And as many of you know, as healthcare providers, anytime a pregnant woman is sick with anything, think about influenza or some other disease, there are risks to the baby. When mother is compromised, so is baby. So women who are pregnant with COVID illness, again, much more likely to be hospitalized, much more seriously ill, and more pregnancy complications. Pregnant women are probably also at higher risk for contracting a COVID illness as well, just because they're slightly immunosuppressed during pregnancy. And we see that with other things as well, like influenza. So there's a lot of data to this point about giving COVID vaccines in pregnant women, and there have been no safety concerns. There are actually studies that have looked at this. The CDC has been following this. There haven't been any pregnancy complications over the average level of complication. There's a certain number of women who have preeclampsia. That those levels stay steady between women who've received the vaccine and not received the vaccine. And also, there's no increased risk of miscarriage for women who've had the COVID vaccine. So safe during pregnancy. There are now 22 professional organizations that have come out and support and recommend COVID vaccines during pregnancy. So it's not, it's not just a few groups or not just the CDC. So then often get questions come up about fertility, COVID vaccine and fertility. COVID vaccines do not affect fertility. There's no evidence that they do. It's unclear where this idea started or how it started. There have been several studies addressing that issue. It is hard to study a little bit because, again, this is a new illness, new vaccine, and we haven't had a lot of time under our belt to address this. But actually a group of infertility doctors did a study on their patients since the pandemic has started, or since the vaccine has started, looking at, and this is a very specific type of fertility, but women undergoing infertility treatments and doing embryo transfers, but they found no difference in the rate of success of embryo transfers or putting embryos into uterus between women who have had the vaccine and women who have not had the vaccine. So the successful pregnancy rate was the same between those two groups. And there was also some question or rumor about whether some of the proteins that allow the COVID virus to enter the cell are similar to proteins involved in implantation of an embryo in the uterus, and thus the vaccine might affect those proteins involved in implantation. That has been studied extensively. They've compared the protein structures of those two things, and researchers said, no, they're not anything alike. So there seems to be no effect of fertility on vaccines from the COVID vaccine. In addition, in the history of time of all the vaccines we have, there's been no other vaccine that has caused fertility problems. So, even though we can't grab a ton of, it's a very specific thing and not lots and lots of studies on this, again, because the vaccine is newer and it's sort of a hard thing to study. There just seems to be no evidence. And then just looking at other vaccines have not caused fertility problems in the past. So another question I had was about chronic kidney disease. Someone asked if they should have the vaccine because they have chronic kidney disease. Absolutely, yes. As we all know, kind of any underlying serious health condition that we have, whether it be diabetes, hypertension, kidney disease, pregnancy, increases your risk for more severe disease from COVID illness. So persons who have those conditions, it's sort of even more important that you get the vaccine to protect yourself. In fact, kidney disease, I was surprised to learn, is the number 2 risk factor for more severe disease only after age. So your greatest risk factor for getting really, really sick from COVID is being older, as we all know, unfortunately. But the number 2 risk factor is chronic kidney disease or severe kidney disease. So yes, those people, and the professional organizations, the American Kidney Foundation and transplant doctors all recommend COVID vaccine for chronic kidney disease patients. And then I think the final question I received was, it says, why should I have the vaccine if I worked on the COVID unit and didn't get sick? My immune system seems pretty good. So I would say if you worked on the COVID unit, we're of course unvaccinated because we didn't have the vaccine when the COVID unit was up and running. I would say you were very, very good at using your precautions. You used your mask well, you used your shield, you used your PPE, and that's great. So that demonstrates that you did a really good job taking care of yourself and taking care of the people around you. But as we've talked about, in the last 10 minutes here or so, having the vaccine adds another layer of protection, and not just another layer of protection, like a tremendous layer of protection. The vaccines are extremely effective. And when we look at managing this pandemic or trying to mitigate it, I think we all understand that we have to take a whole bunch of different strategies. There's not going to be one silver bullet that takes care of it all, whether it be a drug. I mean, maybe someday there will, but right now there's not a drug or a vaccine. So we have to use everything at our disposal. And that includes masking, social distancing when we're indoor, washing our hands a lot, taking care of surfaces, not coming to work when we're sick. All that stuff, but immunization is right up there as the number one thing that we can do to protect ourselves. And again, with the Delta variant being the prominent variant right now, is so much more transmissible. So again, I say, great job. If you work the COVID unit, you weren't vaccinated, you didn't get sick, you did a really, really good job. There was maybe a little bit of luck with that too, but now with this Delta variant around, just it's so much more contagious. So I, of course, would recommend that anybody that's unvaccinated get vaccinated. I mean, and this is about, it is protecting yourself, right? But as you protect yourself, you protect your spouse or your children or your, mom and dad, and of course the community here. And that's, that's asking you to do something that's unselfish, but I would argue, doing it for yourself is a pretty darn good reason as well. So, questions?
I have one.
Yes.
I know it's been out since we had COVID-19 last year and we have the next one wave coming in,
Yeah.
do we have to keep on getting booster shots every year for this?
So, great question. We don't know.
No.
So, and I think I kind of skipped over something. So, back to how long immunity lasts. I said we kind of don't know, either from vaccine or from disease. But studies are showing, maybe sometime in the 6 to 8 month time period, immunity starts to wane. If you did get some immunity from disease or you did get some immunity from vaccine, so it starts to go down. Does it go down in everybody the same amount at the same time? We don't know. Does it go down? Does it start to drift low enough that you're still not protected? We don't know. So we need lots more information. But as you know right now, there are some booster recommendations coming out. Booster shots for the mRNA vaccines, that would be the Pfizer or the Moderna, is recommended for anyone that is severely immunocompromised. So that means, on strong immunosuppressant drugs, like if you had an organ transplant or you're very immunocompromised from like cancer, chemotherapy, or something like that. So right now, there is active booster shots going around for that very select population. And they are recommended to be boosted if 1 month has passed after their second vaccine. Okay, so just 1 month. Probably at the end of this month. So the CDC has recommended, starting on September 20th, that anyone, all comers, you don't have to have any special conditions, who have had the vaccine previously, get a booster shot 8 months after your second one. That hasn't worked its way through, so it was a recommendation by the CDC that has to be approved by the CDC's sort of vaccine, subgroup or whatever, but it's fully expected that that's going to be approved and recommended, so that by the end of September, the recommendation will be that anybody who's had one of the 2 mRNA vaccines get a booster 8 months after your second one. So right now, yes, boosters are recommended. After that, I don't know, so they'll study it, right? So is the third shot, does that now boost your immune system so well that you're good for 3 years? We don't know. But great question. It's whether it's going to become an annual flu shot, I don't know. Like an annual flu shot, sorry.
I do have one more question.
Yeah.
I know this is out there, but I know when this came in, we were all concerned because we have pets. We have all pets. I'm surprised a dog and cat don't get this. Because their noses are more sensitive than we are.
Yeah.
They're out there more than we are, and they're literally running. And my question is, how come the human beings are getting all this sickness and other animals aren't?
Don't. Yeah,
Is
good.
it because of their I don't know, their immune system, or I understand that we're different bodies, everybody's got different bodies, everybody has different immune systems and everything, but it's amazing that a cat and dog doesn't get it, because those two are mostly adorable pets that we
and we hug them, and they lick us and all that stuff.
Beings, but
Yeah.
that, it's like, I'm surprised they haven't got it. Considering what's out there, I mean, we have a lot of diseases out there, and we deal with a lot of different varieties of diseases.
Yep.
And you look at the animals, why don't they get it?
I guess
I know it's out there, I know it is, but I'm saying it's our human body is just much different because
absolutely, and that's probably
it's much different. And then the other question is, the mask mandates. I know they're going to come in soon because I've been kind of watching the news. For our goggles and everything, I'm surprised they're not as tight as close to our face because your eyes breathe. And so your ears. So if you're going to wear this, you would think you'd have something just a little tighter along your eyeballs because your eyes breathe. Because that's a sign that we don't know if it's airborne. I mean, we don't.
Well, we do know it's airborne. It's very airborne. Yeah.
Very airborne.
Yeah.
So my question is, why don't they have tighter goggles? That's why.
Well, they do, and you could wear them if you wanted to. So the tighter the better, really. I mean, I've started to pull out my N95 again, And the reason an N95 mask is more effective than, so what you all are wearing is great, it protects you some, but honestly, it is better at preventing you from spreading COVID disease than, I mean, it does protect you. I don't want to say it doesn't protect you, but it's not as effective as like an N95. And why is an N95 better? It's made out of better filtering material, and it like suctions to your face. You know, it's really tight. There are no gaps. So same thing with the eyes. Yes, if you chose, you know, the eye shields or goggles or whatever, I mean, really, they'll stop like droplets coming at you, right? But yeah, you're right. They're not going to stop minuscule, you know, aerosolized stuff. So if you, yeah, the tighter the better, honestly. You know, if you wanted to wear something that was really suction to your face, go right ahead. It's, you know, it's a matter of balancing comfort, you know, working a 8 or 10 hour shift and, you know, and something that is a little bit more uncomfortable, and, you know, protection. So, animals, yeah, I mean, I guess, so there have been a few, and who knows why someone would study this or whatever, but, you know, they have taken specimens from like dogs or cats' noses, and there have been a few documented like, oh yeah, there was COVID virus in there, but they don't seem to get sick. And probably just because, you're right, they have different systems than us. Maybe they don't have the right receptors to take up this virus, you know, into their, because when the virus gets into our cells, it replicates itself and makes a whole bunch more virus, and that's what makes us sick. So, you know, maybe it can get in the dog's nose, but it's not being taken up into their cells and replicating and making us sick. But that's, you know, think about, you know, measles or influenza.
It's
or,
all about science and, you know.
yeah,
That's all
yeah.
about.
Dogs don't get the flu, you know, so that just sort of fits with,
Right.
you know, their chemistry is different than ours, or their biology is different than ours. Was that it? Was there another question in there?
Nope.
Okay.
Those are the only two
Okay.
questions I have, because, you know, that I'm just a little leery, and I just want to know what's going on with the COVID spot. So that's a good question. Thank you.
Thank you. Anybody else? Please. Oh, I thought you were raising your hand.
All right.
Thank you.
Other questions? Thank you, Dr. Wedl, for being with us this morning.
You are welcome.
Thank you. Yeah. Dawn is here now, and she is going to take the stage or side stage to talk about some of the things that are actually happening here right now in Wisconsin and what they're seeing.
So speaking of goggles or face shields, this is one of the sites that I have to look at. You can see that Wisconsin is mostly in red here. I'm going to go to the live. This is the United States. This is the level of community transmission. The red is high. As you can see, most of the country is in red. It started in the southern states and came up. Let me see. So just about every day I look at this site to see whether we can remove our goggles or not. So it's not going away. The goggles are here for the long haul, along with masks.
So on what level do we have to get to?
We have to get to blue, which is low. There is red, kind of a lighter pink, substantial. Yellow is a moderate, and then our low. As you could see from the actual map. Okay, I can't find it.
Do you know, John, what they're measuring that puts it into the category of moderate or high activity? Is it community spread?
It's the transmission, how it's
How frequent?
moving through the community.
Okay.
Let's see. Then I want to go through some of our standard precautions. We all know what standard precautions is, of course, treating everybody as if they would have something. It's to prevent disease, to prevent the spread of disease. We're just going to go through, of course, our hand hygiene. What is hand hygiene? Using the alcohol-based hand rubs, soap and water when your hands are visibly dirty. Remembering that before and after touching a patient, you're washing your hands. Before or after touching things in the resident's room, or as you're pushing someone down the hall, their wheelchair, washing your hands after you've set them at the table, things like that. Remembering after contacting any body fluids or any invasive procedures. When you remove your gloves, washing your hands. Very important. When you kind of just pay attention to, as you're entering a resident's room, how many times you touch things in that room. From CNA, nurse, housekeeping, maintenance, let's say laundry, going into the room, opening the closet door. Who else has touched that closet door handle? Have they washed their hands before they touched it? We don't know. So the important thing is remembering washing your hands. Let's see. The use of personal protective equipment. If there's possibly an exposure to infectious material, how do we know? Keeping the equipment clean, very important. Don't make assumptions about the care of the resident. Everything's changing so quickly. Following the correct PPE protects the resident, protects you, protects your family from you taking it home. Of course, our specific orders, how to take it on, how to put it off, take it off. I'm not going to go through that. We'll talk about that in a different session. Our transmission-based precautions, it's too early, sorry. Remembering contact, through contact with any infected individual or surface or equipment. Droplet, of course, spread through sneezing, coughing, and again, through your respiratory tract, through your nose. Airborne, of course, spread through the air. Most airborne diseases we will not keep here, like tuberculosis. We will be sending them out to the hospital because we do not have negative air pressure rooms. So, all different infections, you could use a different precaution. With our signs on the door, remember, washing your hands, using the equipment that you need to go into that room. If you're going to be up close and personal with the resident, make sure you're protected. Use what PPE you need. Of course, following the respiratory and hygiene and cough etiquette guidelines, covering your mouth, throwing the Kleenex away, again, washing your hands. Ensure appropriate patient placement. This one, just making sure that if we have more than one person with the infection, where's it coming from? Keeping them kind of grouped together instead of spread out all over. Properly handling and properly cleaning, disinfecting patient care equipment. Clean and disinfecting what you're using, very important. So nurses, your stethoscope, if you're going patient to patient, make sure you're cleaning between them. The blood pressure cuffs. We've been trying to get, so everybody kind of has their own. It's very expensive, but, cleaning that cuff between uses. CNAs, cleaning the equipment between patients. If you're going in with a lift, washing off any place that that resident could grab. The handles, the bars, you know, very important to keep them clean between patients. Our environmental services, you know, keeping the linens clean, not throwing linens on the floor, making sure we have them in the appropriate places. Handling the laundry, of course, making sure that it's in their proper place. That, you know, when you're coming up to the floors, making sure that you have your proper PPE on. Of course, follow safe injection practices, wear your mask, ensure that everybody is safe. Our needle practice, go into that. All right. So with Dr. Wedl and wearing the N95s, we again are going to be going through and fit testing everyone. On the table out there, there is a paper that I need everybody to fill out and return to me. And then we will start scheduling fit tests so that we are ready in case we need them. Yes?
John, when in fact the N95s that they're requiring, do we have to wear both masks together?
You do not. It's just kind of a protection because the N95 has a very short life. It kind of, having the surgical mask over it protects the N95.
Okay. I wear glasses. It hurts the ears, one, and your glasses get fogged up, much worse.
With the N95, they should not.
They should.
Because the N95 is fit tight to your face, you should have no air escaping. If you do have air escaping, then it's not the right N95 for you.
Okay.
So right now, there's no, you're not looking at doing N95s?
We are doing we are doing some N95s on the floors for people who are using CPAPs or people who are using nebulizers. Those are aerosol procedures.
Yeah.
And there is the possibility that if one of those residents would have COVID, that it would be in the air.
So you're recommending right now that if you're doing one of those procedures, you...
That you're wearing an N95.
Okay.
Yep.
These are the right sheets.
Yes, those are the sheets.
Very good.
So at what point do we have to get to before we have to wear them on the floor?
It's really kind of me watching the transmission and our numbers in the county. Right now, the positive, we have a positive number of 88 in Walworth County. There's 114 positive cases in Jefferson. And that's just what we know of. That's just people who have been tested. We all know that there's people who, I'm not going to go get tested, I don't want to know. You know, so I mean, they're out there.
John, how many hours is that N95 mask good for?
What they're saying is 8 hours a day, 5 days. And that's using it as kind of crisis mode.
Yeah, they were developed to be, you know, single use.
Yes.
Meaning single use, you know, you go do a procedure for 3 hours or something. And then if you're pretty much using it all day long, you know, like an 8-hour day, that's what they were developed to be used. But with what we experienced in last year was shortage of masks and so forth. It really got crazy with, see how long you can use your N95. But you can kind of tell, too. So, if we have enough supply for you to use it, 5 days and it's still in good shape, great, use it for 5 days. You can kind of tell also when they start to get, because they're kind of,
They get kind of soft.
yeah, they break down a little bit. You can kind of feel when that's happening. Like a new one is harder. So, yeah, developed to be single use, kind of like a 1-day thing, but they probably are very effective for much longer than that. But
Yeah. Kind of like our masks, we put them on in the morning and take them off at night. Unless we're going into a room that has isolation, you should be changing your mask after you come out of that isolation room. So any other questions?
All right. Let's see. Some interesting observations. I have two friends. One was is a Chinese professor who was here as a visiting professor, and I asked him over WeChat a week ago, how many cases of COVID, because he was making fun of the United States, how many cases of COVID do you have in your country? And I said, well, they're on the rise. I said, well, how many do you have in China? None. Do you really believe that?
No.
Okay, I didn't. But that's what his response was. And this is a highly educated person working in education in China. And so I thought, oh my gosh. The other one is I have a friend in Thailand. And he actually visited here, and I think some of you met him when he was walking around in the community. And he said, Paul, I wish I could get to your country. I said, why is that? He said, I do not want to take the Russian or the Chinese vaccine. That's amazing. We take for granted, and we hear a lot of things about the FDA. We have one of the highest regards in the world for what our FDA, Food and Drug Administration, does in keeping us safe. And so with that, it's really amazing. And so I think we take it for granted, we cut it down, we want to demolish it, but yet they are one of the most highly regarded institutions of the world. And so I think at some point it becomes a faith and a belief in other people, in what we do. And I think that's what we do at Fairhaven. We have a belief in other people and the care that we do. It is important, and it's coming to that point where we can't disregard it. And how do we come to conclusion? I've done some looking back, and my mother did a book several years ago on her family, who actually went through some of the family went through the Spanish flu, 1916. We, of course, did not live through that. But it took multiple years for a country to survive that, get through it, and come out of it. I think we're still kind of in that process. The only other thing that our generation may have seen, and I hope we don't see this again, but is, or the generation that we're serving now, would have been polio. The scare and the fright and the same emotions our country is going through now is the same thing that was going, separation and trying to figure out what is right. And I think when we look at the sciences, what it's done for us and what it's doing for us, I think we forget. I think we forget too, when the vaccine actually came out, the scientists didn't say it was going to be perfect. They said it would offer some protection. And I always heard that. And when people started saying, well, it's not doing its job, well, it is doing its job. We never said it was perfect. And so keeping it in perspective, and in the world perspective, the other thing I hear is cries of other nations. And I sit here in the United States and I think, my gosh, there are still countries out there that have not had the opportunity of being tested or the vaccine. And here we sit in one of the most highly tested organizations of the world. Just in a nursing facility. How many times have you been tested? Hundreds in the last year. It's amazing what we have available to us. And so taking that for granted, I think we just have to be really careful of how we treat that honor that we have in this country. And so there are people that are working for us, not against us. So that being said, consider, yes.
I have a question for Dr. Wedl.
Sure, she is here.
When will there be a vaccination for the youth under 12?
Probably soon.
Yes, don't know. No, I have no inside person in CDC or anything. But I'm thinking that probably the next age group that is available to you is 6, probably somewhere around 6.
May I ask what the holdup is? It's because of the growing body?
Just it needs more, so whenever you study something like a vaccine, you always start with adults. You know, they have more resilient systems and it's safer, you know, to monitor adults first. And so this is always a process with vaccines, and then you slowly move it down to different age groups. So I'm sure they're studying different doses, you know, which dose is required to be most effective, kind of lower dose be given in children. So it's just, you know, as most medicine and vaccine studies start, it's always adults and then slowly move it down. As you get safety for this age group, okay, now let's test this age group. Okay, safety for this age group, now let's test.
So they just hit the targeted one that it was.
Well, I mean,
Definitely
they start with the least risk position. Okay, you know, yes, children are growing, changing, developing, so you don't want to start with them.
Do you, in your opinion, do you think there'll be one this year?
Pick 3 out of there for me.
This year, 2021?
Yeah.
I do, yeah.
Okay.
Probably down to that, you know, whether 5 or 6 or, you know, something like that. We probably won't be doing 2-year-olds quite yet, but I think, yeah, by the end of this year, it'll be in.
Okay, thank you.
Mhm.
Okay. All right, and last but not least, any other questions? So I've got 3 names. Did everybody get a ticket in? I think everybody does, okay. I don't have a particular thing for you today, but I'll figure it out by the end of the day. How's that? That's why I needed your names on this. So everybody knows we do a raffle, and so I was not thinking. And so I have 3 names, and the numbers are, or let's see, I think I've got the nuts. Krista Fox? Christy?
Oh, she must have snuck out.
Oh, snuck out, okay. Terry Munger. Yep, okay, so I'll have one for you. And D. Jones. Perfect, okay. Thank you all for being here today. Again, highly valuable. We appreciate the work you do. We cannot do it without you.
I would really like them back by the end of the week, but at least by Monday.
Gotcha.
You want it back now?
If it's done, then yes.
So, very good. Any other questions? Please let us know. Again, we appreciate it. We can't do without you. And we know, we look forward to planning and working with you. We want to do the best. I should say that Dawn didn't say is that we do have plenty of PPE. Betty Shelb on a regular basis monitors that. We have never been without. We have never had the right product. We have always had sufficient supply of testing and product, and so it's amazing. And so we want to assure you of that. We will continue to have that supply. We've put up stocks. We've already taken a look at 3rd floor to say, God forbid we have to open it again. But what does that look like? And so we're already in the process of preparing. It is, you know, it's something we don't want to do, but we want to know the right steps. We learned a lot last year. There's a lot we learned in that process. And there's a lot we could do better. And so that's what we're looking at, is defining that, making sure that if something ever happens, we've got the right steps. Nobody is panicking. Everybody's already been through this. It's old hat. We know what to do. So, and when we look at the number of people in the population that do what we do, they can't do it. And so we know it, we've got this. And so you've been there and done it, and we appreciate your work. So thank you.